Okay, so good evening, everyone. My name is Paul Orff, and I'm the director at VaultFast. We're a UK-based advocacy communications organisation which seeks to reduce drug-related harms. Thank you, everyone, for joining this evening's webinar. We appreciate you all taking the time out of your evenings and hope you find today's discussion interesting and an opportunity to ask any questions you might have about cannabis and multiple sclerosis. I'm very aware that people watching this discussion live or once it's available online might benefit from some context as to where the UK is currently at with regards to medical cannabis. So before I introduce the other speakers, Dr. Ilan and Fern Prince, I want to quickly set the scene for the discussion and share some of our reflections and insights over the past few years. So on the 1st of November 2018, medical cannabis was legalised in the UK following two high-profile cases of epileptic children that benefited from use of the drug. VaultFast ran one of those campaigns and have many fond and wacky memories of working from restaurants and taxis and hotels as we charged around London, lining up meetings with journalists and politicians. And ultimately, those campaigns led to the government's decision to move cannabis from a Schedule 1 to a Schedule 2 drug and enabled the Home Office to issue importation licenses for medical cannabis products. And although not available on the NHS, medical cannabis prescriptions are legally issued by specialist prescribers across the UK. And in those early days of medical cannabis legalisation, there were some clear challenges due to the fact that the government was essentially pressured by the public support and outcry of the campaigns. And due to the effectiveness of those campaigns into legalising cannabis, the public were kind of left behind and not really educated or brought up to date with the consequences of rescheduling. If you compare what happened in the UK with, cannabis legalisation that's taken place, or medical cannabis legalisation that's taken place in other areas, there's much more of a concerted effort to bring the public up to speed. But not here in the UK. Recent polling that was carried out early last year, showed that something like 80% of the public had no real idea that medical cannabis was legal or available on prescription by specialist prescribers. So alongside a lack of awareness, early on there was quite slow supply chains and costs of the medicine were an issue. Medical cannabis in the UK expanded far slower than many people had anticipated or desired. But fast forward to 2024 and the sector's looking much more attractive for patients. Medication costs have reduced significantly. Supply chains are far more efficient. And through technology and innovation, the patient experience has improved. Although not without challenges, it's in a much healthier place than it was in 2018. Public awareness, however, remains relatively low. And at VaultFast, this is something we want to change. Alongside our campaigning work and commercial work, VaultFast is also the co-secretariat for the APPG for medical cannabis on prescription, which is the all-party parliamentary group, which means we spend a lot of time talking to politicians across government and exploring how we can increase medical cannabis awareness. And today's event is one of many that we will host, where we examine a particular condition for which medical cannabis is legally prescribed in the UK. We will invite clinicians and patients to share their experience and their knowledge. And it's through events like this that we hope will increase awareness, dispel misconceptions, and provide an opportunity for our panel to answer any specific condition questions. So while I have everyone's attention, also check out our website, vaultfast.me. It's a great resource to learn more about the cannabis sector, and watch our YouTube channels, which I already put in the chat. I'll put again on later on, where we'll upload this video, but we also do other videos and discuss and debate the sector. But with that being said, let's kick things off and I'll introduce my fellow panelists. So we have Dr. Ilan Lieberman, a pain medicine consultant and prescriber of medical cannabis through Script Assist, a tech platform supporting the digital prescribing of medical cannabis for private independent doctors. I've known Ilan for a while now, and I'm always impressed not only by his comprehensive level of clinical care that I know he provides patients, but also his ability to explain the complexity of cannabis with ease. So it's great to have you with us, Ilan. I also have Fern Prince, who is the Vice Chair of the Medical Cannabis Patients Association, or MCPA. Fern has an exceptionally relevant and interesting story to share today about her experience of medical cannabis and MS. Fern and her colleagues at the MCPA, some of whom I've seen in the chat, and also I know also being seen by them on Discord, are doing an incredible job of helping patients navigate the medical cannabis sector, and her dedication to helping find stigma and improve awareness is fantastic. So Fern, it's a pleasure to be chatting with you tonight, and I really appreciate you taking the time out of your day.
Thanks for having me.
And your cat. And the cat are all...
Yeah, the unexpected participant of the night.
I'm logging in as an attendee. So, as I said before, questions are really welcome throughout the webinar, so feel free feel free to fire them in, and I'll kind of just manage them either on the spot or wait later on. So, Fernie, if it's all right, we're going to start with you. Just get a bit of context of your experience, and then we'll move into chatting with Ilan, and then the three of us will just kind of explore these topics all together, followed by the Q&A. Does that sound okay?
Yeah, that sounds good to me.
So,
sorry.
Go on. I was just going to give you, I know we've already chatted before, but I was going to give a quick prompt, which was, could you talk a little bit about your diagnosis with MS and kind of how tell us how medical cannabis kind of became part of your life?
Yeah, I was diagnosed relapsing remitting in 2017. I had quite a quick diagnostic procedure because it hit hard and it hit fast. So I did manage to get diagnosed within about 3 months of presenting at the hospital with symptoms, but overall it was about 6 months from symptom onset, which I appreciate is not everyone's experience. So I do feel very lucky in a way that it was caught very early. I've been on a disease-modifying drug, which will continue to be on indefinitely because of the nature of the condition since December of 2017. And I use black market cannabis from around 2019 to sort of self-medicate my my issues on my own in conjunction with the disease-modifying treatments and also the treatments that they give you pharmaceutical-wise for symptoms. It was something that I'd sort of, because I'm a reader, I'll read everything I can possibly find about my conditions, just for my own peace of mind and also a bit of kind of compulsivism. But so I was peripherally aware of it, having potential health benefits from fairly early on, just through sort of the zeitgeist and reading and things like that. But I wasn't initially aware at all about sort of the medical side. So I did very much come into it from a sort of illicit marketplace originally.
Can you remember those 2018 campaigns? I always find that really interesting to ask people. Like, could you, because we were so absorbed in it, I think that we kind of assumed that people would just kind of see it in the news and become aware of the legal market. That cut through to you, or?
In all honesty, in my experience, I was so caught up at the end, coming out of sort of quite a heavy diagnosis that I do not recall very much of the latter part of 2017 or most of 2018, just because I was so sort of embedded in what was happening to me that the sort of any sort of social things that were happening at the time, I really have very little recollection of. But yeah, so I probably was aware. I just don't remember it now.
Fair enough. So what was that kind of? So you sort of using it illicit market like 2019.
Yeah.
And then carry on with that journey then. So how did you end up being legally prescribed? What was your kind of journey like? And
I think once I felt that I was getting a sort of therapeutic benefit from using it black market, I thought, well, the NHS are talking to me about Sativex, which, if you're not aware, is the synthetic cannabinoid that the NHS will prescribe to you for spasticity, which is something that I do struggle with. So I sort of thought, well, they're talking to me about a synthetic. There's got to be other options, surely, for me to explore outside of that in the legal market. So once I was having that sort of conversation with a doctor and saying I'm not interested in a synthetic, I then started thinking, well, I've become more and more aware as time's gone on that it was legal. And I just sort of, I think once I got over the idea that I was doing something wrong, I was more happy to sort of think, no, you know what, I'm going to do what's right for me and I'm going to do this properly and I'm going to go through a doctor and I'm, just not so much to legitimize it to myself, because I was very well aware of how well I was getting on with it. It was just to legitimize it in the eyes of other clinicians a lot of the time. I've always been very open with my clinicians about my use, because I don't believe in hiding. I don't think there was any stigma in it for me personally, if I'm getting therapeutic benefit from it, I'm not going to lie to a doctor about that. So it was more just that I wanted to take the legal route to legitimize myself to a doctor, and essentially, and just to sort of be safer and know that I was doing the right thing, that I was doing it under the care of a doctor, and just for that extra added layer of support from sort of medical professionals to say that I was doing what is best for my condition.
And what was your experience like of using medical cannabis for MS then? How's it kind of impacted on your condition? What's your experience been like of using it?
Well, the first thing I kind of use it for is for pain. So it's kind of twofold, because there are two different types of pain associated with MS. I think you've got your sort of physical spasticity pain, which is obviously muscular. So that's very much something that I find a direct therapeutic benefit from medical cannabis. It's very, very quick to work, to loosen up the sort of horrible tightness sort of in the legs and things like that. So that it was very therapeutic straight away for that. But then the secondary pain that comes, this sort of, you sort of, I've forgotten the word for it. Ilan, what's the word for it? With the neuro, oh my God, it's gone.
Neuroplasticity?
Not spasticity, oh my God, it's gone.
Sorry.
Just describe the symptom to me again.
Sort of the like the burning, the kind of
the neuropathic pain.
Yes. I was like, it's neuro something, it's totally gone. But yes, yeah, the neuropathic pain was sort of the secondary sort of pain pathway, as I sort of think of it. And that I find has a different effect for me in terms of the therapeutic benefit I get from it, because I guess the mechanism of the pain is very different.
Yeah, absolutely.
So
I'll talk about that.
I don't sort of find the initial sort of painkiller the same as when it's a physical pain. It's more of a mental distraction from the sort of burning, the tingling, the sort of horrible nagging pains that you get as a secondary. So it's kind of, there's a dual benefit to it, because once your mind is distracted by the cannabis, by the it's sort of stopping those pathways sort of thing. For me, I find that I'm kind of distracted from it, and that is to me as much benefit as the pain having gone away completely.
So from a lifestyle perspective, I guess that helps loads with just sleep and being able to concentrate on things and just get about day-to-day functioning on.
Yeah, sleep definitely, because for whatever reason, I don't think anyone will ever explain why it seems to be worse on a nighttime than it is during the day. For me anyway, yeah, sleep is obviously a big one. Just to be able to relax enough to go to sleep, or at least distract yourself enough from the pain that you feel to go to sleep. That it is a really big one for me in that respect. In terms of sort of other day-to-day symptoms, I'm still on a bit of a journey with it as well. I think probably we all are, in a way, trying to find the best way to use the medication for ourselves. But I do suffer a lot of primary fatigue, and I'm still working out how to best utilize my medication to try and mitigate a little bit of that. So, it's not sort of, it's not a one-stop, right, you've got this medication, you're on it, that's it, you're good to go. There is a little bit of work to be done, but I'm happy to put that work in to get the best benefit out of my medication.
And I guess that's where the relationship with the clinician becomes so important. And I guess, Ilan, you've got a lot of experience of helping people navigate and manage that, because it's a huge difference, I imagine, between what you could, I guess, illicit use or black market use from, clinically prescribed. Legal market, you get that additional consultation from a doctor and a whole.
Yeah, but I think more than that, you get you get continuity of supply, you get safety of product, and you get a variable. You get clarity on your dose and the nature of the dose. So sometimes when it's a bit like in the old days. People might not remember this, but in the old days, you used to have an aerial for your TV. And sometimes if you lived in digs, you had this like sort of a coat hanger type aerial rather than the aerial on your roof. And you'd go through these periods of time where you'd put it in one position to get a good signal. And then sometimes when you stood on one foot, the signal was when you didn't stand on one foot, and you go through this, should I have it on the mantelpiece? Should I have it down below? And you moved it around. You never really knew whether that bit of moving the aerial was making the difference to the signal. And I think continuity of supply is a bit like that, isn't it? If you're getting continuity of supply from someone like Scriptosist, you know what you're getting. Okay, you're getting a medical grade product with some quality assurance around it. If you're getting it from an acquaintance in the pub or something, you don't know whether your aerial's on the top shelf or the bottom shelf. If your MS is playing you up, you were describing for an allodynia, these sensations that are painful to a non-painful stimulation, this feeling like patients get that they have ants crawling under their skin, or their foot feels wet, or it feels hot, or those
the wet foot.
Yes, and those types of neuropathic pain experiences, you don't know whether, but sometimes it's just not there. And is it not there because you don't know really whether it's the dose of drug that you've got from your mate in the pub, or whether it's gone because it's gone, or whether feeling sick because it wasn't just cannabis that was in the stuff that you got from the pub. Whereas what you essentially pay for when you buy medical grade cannabis is that you're paying for certainty. It's like plugging that aerial into something on the roof or something through broadband. You're getting continuity of supply, getting quality, and you're getting reassurance that what you get is safe. And that's the difference.
Yeah, I mean, obviously, anyone who's come from the sort of illicit market knows that just because somebody tells you it's a certain strain or it's going to have a certain, those strains have got a sort of certain effects that you would expect, doesn't mean that that's what you've got. I can pick up a bag of anything and write whatever I want on it. You know what I mean?
Absolutely.
Ilan, do you want to share some of your experiences with and kind of provide?
Yeah, I mean, I'll tell you what, if it's okay, I'll just put my slides up and then
go for it.
Very well. Show old man IT here. So hopefully everyone's seeing not my daughter's party invitation, but just the cannabis slides. Is that right?
Yeah. You're good.
Okay. So just for the audience and everything, thanks a lot for coming along. It's always educational for me to listen to patients who are on a journey which is very different from my own, and I always learn something when I have a Q&A afterwards with patients. I'll always take something away which I think is valuable, and that's honestly why I do this, because it's a learning experience for me as well as a pleasure trying to help people. So I'm Ilan Liebman. I'm a pain medicine consultant. Let me just see if this works. Great. So I trained back in the day at the London Hospital Medical College before it became the Royal London Hospital, before it became Queen Mary and Westfield University. I think they dropped the Westfield thing because it's Queen Mary University now. I've been in pain medicine for 22, 23 years, and I've worked in pain medicine full time for about half of that time. So I've always been a bit nerdy, and I sort of got into digital healthcare as it evolved. And for a long time, while in my pain practice, I had patients coming to me telling me that they smoked a bit of weed, or they had some edibles, and that helped their pain. And it always piqued my interest. And I, when I trained as a pain medicine doctor, I worked as a fellow over in Liverpool at the Walton Centre, and a lot of my bosses there were very much involved in the promotion of opioids for non-malignant pain, and people like Russell Portnoy of Dope Sick fame came along and lectured, and I gave I was aware of all the slide sets and all the marketing, and I lived that opioid wave. So I've not actually seen Dope Sick on TV, as I keep on telling my kids, I was in it. I don't need to watch it on Netflix. I wasn't like Breaking Bad sort of in it.
Yeah, you're telling on yourself here.
Yeah, but Your Honor. But I was aware of it all. And when I started looking at medical cannabis and cannabis, I viewed it through that kaleidoscope of what went wrong with opiates and what is continuing to go wrong with opiates. And I was never keen on being just running a single modality opioid, cannabis clinic, because people come to me, and my philosophy is people come to me for advice about their chronic pain. That may be chronic pain from MS, but people with MS have chronic pain which isn't related to their MS. People have fibro, people have pain after injury, et cetera, et cetera, et cetera. So I look at it, people come for my advice, I make an assessment, I go through stuff with them, and then if medical cannabis I think is suitable, we'll discuss it. And then maybe we'll do something. It says here new to cannabis prescription. I'm less new than I used to be. But have I been prescribing medical cannabis for years? No. Have I been prescribing Sativex and Nabilone for years? Yes. So I've got a big cohort of patients in the northwest of England who are on Sativex, and that is predominantly for spasm related to MS. But I've yet to meet an MS patient who doesn't have pain with their spasm. So I think it's a slightly disingenuous thing that doctors say that we say spasm because that's what, we're meant to be prescribing it for. But the reality is we all know that it's treating pain as well. And most people, I think, life is so uncomfortable. If you said to them how much of it is spasm and how much of it is pain, they'd look at you like, it's raining outside and you're asking me how wet I am. It's a bit of a weird question. So basically, medical cannabis are the unlicensed cannabis-based medical products, the tinctures, the edibles, the oils, and the flower. And the licensed medical cannabinoids are stuff like Sativex, Epidiolex, and things that are licensed by the MHRA. Okay, so just so that we're clear, I've got lots of patients who I started on Sativex for their MS spasm and then asked for permission afterwards. And the Northwest commissioning intentions and the Medicines Management Committee in the Northwest have heavily discouraged my trust from allowing me to prescribe Sativex for MS-related pain and spasm. And I'm embarrassed about that decision, and I am not going to defend it. So if anyone's got a question about, shouldn't we get it on the NHS, I'm going to put a pin in that balloon. I think you should. Okay, and I'm not going to defend the position that I'm in within the NHS. That is my opinion. I think it is immoral that I can't give Sativex to people with MS. It's not the solution for everyone because it's a fixed 50-50 mixture of THC and CBD, but it certainly is life-changing for some patients. And I'm going to say this to you all. I see lots of people with chronic pain. When I see people with MS, they have to a person approach their diagnosis with a huge amount of dignity. It always strikes me that people with MS deal with their issue with a huge amount of dignity. And I'm embarrassed that I can't give people MS when I see, give people Sativex when I see patients with MS. It really makes me angry because I just think that it's so helpful. And that's what really got me onto this journey of medical cannabis, because I saw people with like I've got a patient who is blind without a Sativex. And it's almost biblical, they were blind and now they can see, but it is literally like this for this person. Okay. And someone had the audacity to say to me, what's the cost effectiveness benefit? And I mean, how can you answer that question? They can see, they couldn't see. What more do you want me to tell you? They don't need a carer. They can see. I mean, how much dignity do you want to take away from someone? I've got another bloke who's on convenes and pads and all the rest of it without his Sativex. And someone said to me, can you justify it? And I genuinely felt like punching them. Obviously you can't do that in a room. It's inappropriate. I'd get struck off. But when people ask you questions like that, you just think, really? Is that really an appropriate question for someone to ask about someone's healthcare? So I do get a bit passionate about it, and I apologize. Well, no, I don't apologize for it. It's important. You need to put your patient first. So that's what got me curious about medical cannabis, because it struck me that I was seeing some very important effects on the synthetics and the manufactured things. And it got me thinking, why aren't we doing what they're doing elsewhere in the world? Why is it that British medicine is so cautious about something which is widely available in North America and Canada and Israel and Australasia and other places? And, the conclusion I've reached in my personal opinion is that we are too precautionary about it. And I say that in the full knowledge that I lived through the opioid wave. So that's why I teamed up with Scriptisys, because they had a vision for a safe prescription platform that I felt I could get on board with. So, look, there's increasing evidence around this, and I don't think it's, useful to bore people with it, for the simple fact that I think you need to think about medical evidence in two groups. Okay, so if I give you a drug for cancer, or for blood pressure, or for, to lower your lipids, for example, I don't know that drug is necessarily going to change the life event that we're giving it for. So yes, you can see that your LDL, HDL ratio changes or your blood pressure comes down, but I could go to my grave with hypertension and the thing that kills me is malignant melanoma or just frailty when I'm 90. And I could have had high blood pressure all the way through. Okay. So there's some stuff that you give, like a drug for cancer. So, for example, our Princess Catherine is on preventative chemotherapy. That's what the papers say. She will never know, and we will never know, if her outcome is any better or not because of the preventive chemotherapy. What we know is statistically it's likely to be. But statistically, what it's saying is, maybe 10 people in 100 won't develop further complications with the drug, whereas without the drug, 50 people develop the complications. I don't know what the data is for her particular chemotherapy, but all I'm saying is that you give chemotherapy in the hope that it prevents something happening. But at an individual level, you do not know whether it's going to make any effect or not. You just don't. So with pain drugs, and particularly with cannabis, that evening. And you just do. So someone might say, well, look, it's placebo. And obviously, it might be placebo. It's possible. But you're still out of the pain, or you're still out of the spasm.
Yeah, so, I was about to say that it doesn't matter to me whether it's placebo or not. If I feel better, I feel better. It
doesn't matter, because what you're buying is an effect. And to my mind, if that effect is so long-lasting, yes, it could still be a long-lasting placebo effect. But really, you've got proper organic disease. Your nerve fibers are demyelinating. That's why you've got a wet foot when it's not wet. You've got proper biological change. And if you then sat in front of me saying, yes, but it might be placebo, well, yeah, possibly, but put yourself in their undies and then say, I'm not having any of the drug. I think that's not a nice thing to do. So I think there's a big difference between pain medications and medical cannabis is that par excellence, and drugs that might help you if you look at the herd data, but you'll never know at an individual level whether it's going to help you or not. And which takes me on to my next thing, which is what to expect. Okay, so in the hypothetical that you come to see me, you've gone through a big sort of biopsychosocial assessment. We've gone through a diagnosis. Because people do turn up in pain clinic, and I think one thing and the reality is another. So, for example, do I think that medical cannabis is going to help someone with a functional neurological disorder? No, I don't. Okay. They may feel it, and, would I prescribe it? Possibly. But do I think it's likely to help? No, I don't. Okay, because I don't think there's a biological functional change that I'm aware of that medication is going to, or the entourage effect, the orchestra effect of the terpenes and all the rest of it is going to make a difference too. But people that I see with MS, Fern, please correct me if I've missed something here. They have these 6 problems predominantly. They have spasm, they have pain, they have poor quality of life, however that is described. Their sleep is problematic, the circadian rhythm is poor, they have mobility issues, and the whole of that affects their independence.
I would say the only other thing I could add on to that is, because of those 6 things, social isolation.
Yes, I sort of meant that in independence, but yes,
Yeah.
absolutely. So when I give someone medical cannabis, I want some metrics around what it's doing, okay, and I expect it to treat the spasm, and however that might manifest with your bowel habit, or your continence, or your blepharospasm, or just the spasm in your arms and legs, and your ability to exercise and function. I think within that is also a pain experience, and I think it's very difficult for people to separate those two things. I think that once you restore sleep and get people's circadian rhythms better, you get an approach to the fatigue that people get. But I also think it may affect the fatigue per se. And all of that, the mobility, the sleep, the pain, the spasm, changes your quality of life. And your quality of life then has an effect on how much independence you feel you have, how much autonomy you feel you have. So if you're spasming less, if you're sleeping better, your care requirements might reduce. You may feel more able to chop up some veg. You may feel able to grab a knife when you were unable to grab a knife. Everyone's situation is different. So it's difficult to say to someone, you're definitely going to get improvements in this, that, and the other metric. But the metrics that you have are your goals, as it were. So one person may come to me and say, look, this is just for my spasm. Someone else may come to me and say, look, I just need some help with my sleep here. And I think if my sleep pattern was better, my overall life experience would be improved, which is why it's so important to get a tailored and sensible assessment of your problems. This is not a medication where one type fits all. Blood pressure, for example, you got blood pressure of, take me, for example, I am, I'm a bit fat. And I probably don't, well, I do exercise quite a lot. I've done 86,000 meters in a row this month, but there have been periods in my life where I've been less vigorous. And, my GP took me aside and said, look, your blood pressure is horrific. It was, I think, 190 over 120. It's not something to be proud of. And all he did was say, look, you need this and that. And there was two drugs, done, off you go. Measure your blood pressure, it's better, thank God. Okay? Treating someone with medical cannabis isn't like that, because it's a nuanced drug. It is an entourage. You've got a ratio of THC or CBD to deal with. You've got different approaches to how you consume it. You could vape some flower. You could have some edibles. You could have some oil under your tongue. So the amount of medical care and input you need in terms of treating the individual with the medication is much higher, I would say, than just giving someone 10 milligrams of atenolol and saying, is your blood pressure better, yes or not? And then the only discussion you may have with your doctor is the fact that your sexual function's not great on the atenolol, so swap you into another drug. But it's a much more transactional, straightforward, sort of protocol-driven type approach to a medical problem. Whereas, my impression and understanding of people with MS is that your problem with your MS is far more pervasive in your life, and therefore the goals that you have and the reasons why you give someone a medication is more nuanced and complex, and that's why you need a sort of enmeshed and embedded medical assessment and care.
Yeah, just off the back of that, just in my experience, sort of when you see your neurologist, they're very much like, we are looking only at your MS. That's all we care about. We're focusing on this. Whereas when I speak with my medical cannabis doctor, it's more of a sort of nuanced, sort of a holistic approach to the body, to the medication itself, which I often find has been lacking in other care that I've got, that this focus on one specific thing and don't look at everything that could play into that. Where when you're looking at sort of treating with cannabis, there is a bit more of a holistic look at everything that's affecting you and everything that can be treated, or if not treated, then at least helped by the medication. So I don't know, I've always felt more heard in a way that I want to be treated as a whole rather than as a symptom.
What I would say to that, Fern, is that it's really sad that one hears that from someone, because my philosophy with all this, my view is this, that, you know, apart from stuff that's very transactional, like, you know, an orthopedic surgeon putting a new knee in you or something,
Yeah.
the rest of medicine should always be about the whole person. It should never just be about one little thing. And we've lost that. I mean, and this is just my personal opinion, but I think medicine's lost its way in that regard. You know, we've lost the fact that you always get the same GP, and, you know, that whole concept of just having a direct relationship with your GP is gone.
Yeah, there is no human element left anymore.
Unless you are, you know, paying privately for a specific doctor, you get anyone there. And so that continuity of care, that nuance, that pause in the conversation where someone's looked after you since you were 7, and someone says, Fern, I know you say you're okay, but are you really? Because you're not like you were last week or last month, or there's clearly something on your mind. That's just not possible when you don't have continuity of care. And so my philosophy with all of this is that, you know, and maybe it's because I'm a pain doctor, but I think I'd like to think I would be like this if I was a cardiologist, is you have to have a biopsychosocial approach to someone's healthcare problem. Because even if you've got, you know, ischemic heart disease, you're worried about if you're going to die, you're worried about your life insurance, you're worried about your family, you're worried about your exercise, you're worried about this, you're worried about that. And that may rarely be why you sit in front of the doctor. And so, you know, when people come in, I train them and I talk to them and I explain to them how do you conduct a chronic pain consultation, Dr. Lehman? It's not magic. You know, it's not bloody Hogwarts, this. You just, there's no dark arts here. You just talk to people like, you know, they're human. And you ask them their problems and you listen to them. And, you know, you do more work with the ears than you do with the gob, which I find difficult. But, you know, you listen to people and you understand their problems. And then you help them with them. And that's what attracted me to medicine in the first place. And so it does make my heart sink a little bit when I hear, you know, the neurologist is just interested in my MS, because, you know, MS affects the whole of your life. So they should be interested in the whole of your life.
Well, I say they do also help us with my migraines as well, but it is more of a sort of brain focused sort of consultation, which I do understand that it's budget and it's time and that there aren't enough doctors in neurology to cater for all of us, and that's a real shame. But
it is, but I wouldn't give them such a hall pass. I just
maybe I am too understanding and too nice.
I just think as medics, it's not your fault. It's our fault. We have lost our way. We've forgotten what we're meant to be doing.
It is refreshing to hear that from the other side as well. Though, as much as I broke your heart saying it, you've filled mine a little bit just with your sort of philosophy on this. Just that it, you know, that there are still doctors who do actually care and did get into it for the reasons, the greater good, if you see what I mean. Because sometimes I feel that the human element has gone. So it's good to know that, you know, there are still some good ones out there.
When I was 18, the thought of going to a workplace that was predominantly filled with young women wasn't a big motivator for me. There were other reasons why I got into medicine, and I'm not being completely, you know, people for lots of different reasons. But I think that your journey through medicine teaches you to understand that you have the best interactions when you take a look beyond the narrow funnel that you're in. Absolutely. So, all right, let me just go through the rest of the slides.
We've got some really good questions coming as well. But
I think that might be the end, actually. Oh, no, I've got one more. Pardon, let me just finish. So just in terms of showing, if no one's seen the script assist thing, what really goes on here is you have an interaction which is predominantly digitally driven. So after you've seen your doctor, and because it's about helping people to help their patients in their own private practice, the interaction that you're going to have is with that doctor. So, you know, you've seen me, you've seen it, you know, what you see is what you get. Other people's styles are slightly different, but we will still drive the process through some questionnaires as a find a doctor thing. So, you can have a look at different people's fees and what you can afford, and maybe get a flavor from them, from their from what their bios say. You can book a consultation. What's really important with medical cannabis is that when I say to someone, right, I'm going to give you X grams of flour or X grams of oil of this product, it is reserved for you there and then. So there's no, oh, I thought I'd give you this, but I'm going to have to give you that because it's not in stock. Once it's locked in the app, that's it. And the same thing is when you reorder through the app, it's locked as soon as you put the order in. So you know it's going to be for you.
Do you have slides, Ilan, for this? Because I can just see, oh, there you go. There you go.
Oh, can you not see?
Yeah, it was just the first slide. We just jumped to that now, don't we?
Okay, so this is what it looks like, and you can all go and download Script Assist app and have a look at it. And the QR code, I think if you
slide's gonna go, click back, whatever you did before, click back. There you go. Now it's up. No, it's gone.
I don't know what I'm not doing anything. It's like the aerial or the TV. It's just happening. So
yeah. Clearly, this slideshow's got MS because it's doing whatever it wants, which is kind of what we get a little bit too.
It's an empathetic piece of software.
Yeah.
So there's a QR code up here. I think if you take a picture of that, it will take you straight through to it. So look, and obviously there's lots of different ways of getting and then it's delivered to you and you pay through the app. So that's why I like this, because I think it gives my patients and the service users a really good experience. I'm pressing. I think that's it. I think that's my last slide. So yeah, Q&A. All ears.
I will. If you stop screen sharing, okay. Just that last bit.
Got it.
I'll get the slides, and I'll just pop them for the last bit for the Q&A screen because I didn't see a QR code. So I'll put that up while we do the Q&A because we've still got 15 minutes. So right, so we've got some really good questions. There is actually a question for everyone on the panel, including McQueen the cat. So,
oh, he's gone now.
Well, the question for McQueen the cat was just fish or chicken, so you'll just have to let us know what is.
100% chicken. I can say that on his behalf.
The question for, as you mentioned, your improved sleep. What other symptoms have you seen relief from cannabis, and have you seen any other long-term benefits to your health because of medical cannabis? Do you want to take that? And then I've got a couple.
I've done myself a disservice by not sort of exploring the full sort of benefits of it, but a huge benefit that I have found over sort of the last, prior to being prescribed and obviously ongoing since then, is I was on quite a high dose of antidepressants for almost a decade, and it was with the sort of mental changes that I went through, exploring sort of my own psyche with the aid of medical cannabis or cannabis in general, that actually managed to get me off Prozac for after nearly 10 years. So obviously the mental health benefit has been enormous when there is such a huge mental health burden that comes with a chronic illness like MS or anything that's pervasive, that's ongoing, that there is unfortunately no recovery from. So mentally, I've been lifted, obviously with sleep, that buys you so much, so many extra spoons through the day. If you're familiar with spoon theory with chronic illness, it does obviously buy you quite a lot of sort of extra energy through the day just by having, you're not spending so much of your mental and physical energy compensating for the pain that you feel, the lack of sleep, the sort of fatigue, which has obviously led me to be able to become more able to get involved with things like the MCPA. So now medical cannabis has given me enough sort of life force back to actually take that and run with it, to take it and help me help other people, get involved, like get the word out there with all our campaigns, everything that we're wanting to do. I would not physically be able to do that without the sort of health benefits that I've gained from using medical cannabis, which is, I don't know, it's the quality of life aspect, and being able to take that quality of life to help improve other patients' quality of life is just, I mean, it's just, there's no comparing that. It's just, you can't put a price on that really at all.
That's great, mate. And it's great that you sharing your story and all the stuff you do in the MCPA to spread that message. It's great. It's very admirable. I've got another question for you, and a couple for Dr. Ilan. I'll go back to Dr. Ilan. So, with medical cannabis being prescribed in many different forms and strengths, how patient-centric do you believe the care approach should be for private prescription, respecting patient choices on medication?
How patient-centric could it be? It should be 100% patient-centric as far as I'm concerned. That's the experience I have been exposed to. I went into it knowing what works for me from previous use. However, even if I hadn't, I'd filled in quite an extensive questionnaire so that my clinician was aware of what my needs were straight off the bat. But I know it varies clinic to clinic and clinician to clinician, but my experience has always been, I have outlined my experiences, my symptoms, what I personally believe is helpful to me, and my clinician has always been very happy to take the lead from me and listen to me, which when it's a service that you are obviously paying for, you would assume that that would be the case for everything. But that is something I do like to stress, that, it has been very patient-centric, but also I have been very extremely open with not just the private doctors, but with every clinician I come into. I'm very open with them, and I expect to get that back.
Ilan, you in agreement there? So you're nodding.
Yeah, I think that what's important here is to have an open and honest conversation with the service user, really. Mm-hmm. So if someone said to me they're complete, I've never ever had any cannabis, and then they give me a wish list which is clearly treated to that, okay, and they start talking about what strain they want, and they're banding about names of different drugs, and you're thinking, or different strains, and you're thinking, my word, they know almost as much as I do or more. Then it's difficult to persuade yourself that they're cannabis naive. So I think that the starting point is being open and honest with the clinician. The second thing then is that if you say, look, I would prefer to have this or that, and that seems like a reasonable request, then absolutely one would want to fit in with that. I think if someone, in all honesty, if someone came with me and I thought I had a feeling that what they wanted the medical cannabis for wasn't really what I thought I was prescribing it for, I would suggest really that the best thing that they would do is find another clinician. But I would say 99.9% of the time, I prescribe what people want to take, because we have a patient-centered approach, and what that person wants to take is what I want to prescribe them. So there is always a meeting of minds. And if someone says, look, I'd like to try a bit of flower with the oil, fine. But if someone was like completely cannabis naive, I'd be saying, look, I'm not really sure whether I want you to start vaping if you've never vaped before to take this medication. And we'd discuss the pros and cons of vaping and all the rest of it. So I think it's not, as a clinician, you can't just say to someone, and also don't forget, you've got to take these people to an MDT. So you'd have to justify why you were starting someone on something that you wouldn't normally start them on. And there'd have to be some sort of, breadcrumb trail of why that was reasonable. But I absolutely agree with you, Fern. If you go along to someone and you're expecting a certain level of service, you should get that level of service. And, when people say to me, and when they re-prescribe and they flip between different types of flower, for example, when they want to try one flower and try another flower, but it's a similar level of medication, I think that's down to the individual. I think that really is down to what someone wants to try. And I'm very supportive of that, because you never know what's going to quite help that person until you try it.
Yeah.
So
to give sort of my experience of what it was that I went into it with, just to, if anyone is out there not sure what, you can say to a doctor, I told them I've got previous experience. I know, because I have other issues with sort of digestion and things like that, I don't process edibles or oil particularly well. It's got a very, very long onset time for me, which unfortunately is not appropriate for the kind of treatment that I require. I need it to be very quickly acting, which is what I said. And then I was prescribed flower on that basis because it suits my needs. So if you know what your body responds well to, don't be shy to tell a doctor that. You know your own body better than anybody else.
I've got a couple more questions that I just want to do in the limited time we've got left. Ilan, I just put that slide up because it didn't pop up when you did.
Oh, right, beg your pardon. Right.
But that's well. People can find Dr. Ilan and other doctors through Find a Doctor. I'll stop sharing that now and close that. Right. So other questions that I had. Dr. Ilan, given your trouble prescribing Sativex on the NHS and the large cost of private medical cannabis, do you foresee a change in regulation or acceptance by ICBS in the next 5 years to take away the cost burden of patients? And also maybe some commentary around costs. Because Fern, me and you were talking about this earlier, weren't we, about the difference between costs from 2018 to now. So maybe, Fern, you could pick up the cost point after Dr. Ilan.
Yeah.
So when you say ICBS, you mean integrated care boards, or essentially the NHS, I'm assuming. Yeah. And I think it's very difficult to know that answer. I would like to say yes. I would like to say that some sanity prevails here, and where you have people that have got good demonstrated efficacy, the NHS might start doing this. I think that what we need to do is build up more data, build up more patient experience, build up more people using it, and eventually we will reach a point where people accept the fact that this might be useful within the NHS. I also think that there is a huge fear, unfounded fear, around diversion, around inappropriate prescription, which is unnecessary. And, for example, people with my level of experience could absolutely be trusted to start a small number of people on medical cannabis. I don't see why that's such a challenge. And we have massive healthcare spend in areas where, we shouldn't be spending money. That I think it might be possible, but equally, I don't see much green shoots of change currently. I've got to be honest, and I get people's frustration around that. I think it's probably more likely to be driven by other countries' experience, with us eventually going, oh, right, well, they were right, we were wrong. Then it is coming from the UK itself.
So would you say it's a kind of a case of waiting out the old guard until we get sort of, more sort of clinicians that are aware of this, that are sort of open-minded and less stuck in the older mindset of drugs are bad and, the reefer madness thing? Are we waiting out them, or are we just waiting for the research that'll make the NHS say yes?
I think, and Project 21 is trying to address this and all the rest of it, but I think that we're going to have to present people with data.
Yeah,
I really do, and I just unfortunately don't think we are there yet. And I think the problem with data in medical cannabis is that it is not a product you can put IP around, and that is a big barrier to change. Anyone can grow weed, and so for people to put in sufficient level of funding to power studies up, have enough people in each arm is difficult. And it's not a molecule. It's not a substance that lends itself easily to a placebo. So you all know if you've got some cannabis, you can smell it. Is it part of the plant is something that is smellable, and it's very.
And you would absolutely know straight away if you didn't have.
Exactly. So blinding it, and there are sort of structural problems within a study, which I think are going to make it very difficult. And the frustration is that you only need to talk to people like Fern to go, this works for people. It doesn't work for everyone. But I don't find that an issue. No drug I have ever encountered works for everyone. Or even alcohol. You know, alcohol gets you a bit drunk, but some people hate that feeling and never want to drink.
Yeah.
Alcohol doesn't work for everyone. Alcohol doesn't give everyone the same effect that it gives me, which is I like having a pint. Some people hate that, you know, so nothing works for everyone. And to say, well, you know, it's not a perfect solution to MS. Well, show me what is.
Yeah, some solution is better than no solution at all, believe me.
Yeah, I think that's a really strong point for us to kind of summarize the chat on. I'm a firm believer in webinars sticking to time and respecting attendees. We've just turned over to 7 o'clock, so we've done an hour. I really appreciate both of you taking the time out to chat to us this evening. Really, really good insights, interesting perspectives, and I really hope we can kind of use this to continue to raise awareness amongst the patient community, the cannabis naive, around the benefits of cannabis-based medicines, and hopefully it'll push more people to go to places like MCPA and Script Assist and our website and forums and just go and learn more about cannabis and spread the message, because that is just a constant barrier that we come up against, is lack of awareness and stigma getting in the way of people exploring cannabis medicine. So really appreciate you both taking the time out to chat to us. Hello to everybody, and thank you to everyone that watches on the Discord over at the MCPA. We will put it up on YouTube. I'll email all attendees with the details of that after. Any closing comments from you two before I stop the recording?
Just thank you very much. Thanks a lot.
Yeah, it's been amazing. It's been really great to hear from Milan as well. It's good to see it from a doctor's point of view as well. But I know there were some questions that maybe we didn't get to today. So if anyone did have more questions for me, I'm more than happy for anyone to reach out to me by email. You can get me at phone@mcpa.uk. I'm kind of online pretty much every day, so I can get back to you quite quickly.
I'm just always in the chat. Is it .uk? Did you say?
Yeah, it is.
And you can get me through the platform. So if you go onto the platform, sign up, look for me on the platform. I'm happy to take some questions through that. No problem.
Lovely. Appreciate both of your time. Appreciate all the attendees, and catch us through our various methods that we just outlined, and speak to you all soon. Cheers.
All right.